Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank you for tuning in and liking, subscribing, sharing with your friends and family, and just taking interest to everything that we have going on here at SGMC Health.
And if you have any questions or topics you'd like to hear more about, you can submit those at sgmc.org/podcast.
All right, today we are here with Patrick Murrah, MD, and cardiothoracic surgeon. So Dr. Murrah, what brings you in today?
Well, it's a Friday, and I didn't have a case this morning. My partner, Joe Johnson's doing a really tough one that helped him get started, and I didn't have a lot to do. I thought I'd come in here and tell you about all the good things we're doing, and then our team here at SGMC Health.
All right, I'm here for it. So Dr. Johnson's getting his hands dirty this morning.
Yeah,
Cardiothoracic surgery. For the people that don't understand, what is that?
Well, it's heart, cardio being heart, so heart surgery, anything really above the diaphragm. So mostly heart surgery, but we're doing a lot of exciting things in thoracic surgery also. We have some really good tools that we'll talk
thoracic
about.
is lung, right?
And that's thoracic. It's thoracic being just above the diaphragm. You can have the esophagus, the lung, and the heart. But thoracic is kind of a general term, the thorax. But cardiothoracic is just basically people that do heart and lung surgery and occasional esophageal surgery. Not much, but some.
All right.
So anything in there in the chest.
Well, tell us about yourself first. Give us a little background. What led you to your career, and how did we get you in this seat today?
Well, I think people kind of do what they do for, sometimes you don't know why you do things, but you do things because those are the things you maybe gravitate towards. I became a heart surgeon. It's like going down a long tunnel. You get to where you get to almost the end of the tunnel, and you really can't. That's about all you can do. So it's a long training process. I guess I liked sports as a kid, and I was fairly competitive, and it would appeal to me in medical school that the nature of surgery, the ability to fix things, and more so that you manage things, but a lot of times uniquely in surgery and in cardiac surgery you can really fix things. So that's a very gratifying thing. So and it's a challenge. So, and that's, probably in some ways you create your own misery. You just say, all right, I'm going to try to do the hardest thing. It was a long process. But my wife Allison and I, of 35 years, the 10 years of residency and going through that whole process, she's just as much a part of it. So,
absolutely.
So we sort of chose it together and did it, and so.
Well, what made you decide to be a doctor, a physician in general?
I played golf as a kid. I was going to be a little golfer and do my thing, and I grew up in Titusville, Florida. My dad worked for NASA on the East Coast there with the Kennedy Space Center, and I liked golf. I was going to be a golfer, but then you figured you could play golf and be a doctor. My mom was a nurse. When I was there, when I went to college as the third person going to college, so my mom went to school to become a nurse to be able to pay for college. So that was and so that was inspiring. I thought that was I remember going to the ICU one time, and she's up there in Titusville, and somebody was on the ventilator, and I think must have been, I don't know, I guess I was pretty young, but it was and the guy was sick, and I remember thinking that's not fair.
Yeah.
And that guy got sick and he was not doing well. I was like, wow, I guess as a child, the way you approach things, maybe when you get older, you don't think, there's not a fairness committee meeting on your behalf. But when you're young and you're like, wow, that's real, that person's really in despair, and really, I guess that's inspiring that you can help that person that's pretty helpless.
Wow, that's a cool story.
So, yeah, I just remember feeling that way.
Yeah.
It's interesting.
Huh. Well, so you mentioned going into cardio, thoracic surgery, wanting to do the things that are hard. Tell us about what it's like. We have not had a heart surgeon on our podcast yet. Yeah. So what is that like performing a heart surgery?
It is, if it's hard to do, then you probably need to do some more training. So.
Okay, yeah, that's true.
But it's hard.
Yeah.
It's hard. And it's taxing. But you need to be ready to go, because you got somebody counting on you.
Right.
So you really need to pay the upfront price and get all the training done. So you're just sort of going through
It's
the
a big deal.
process of
It's a big
training
deal
that you're
for
doing
a
that, but
patient to
you're
trust
not.
you.
So yeah, but you're it. So that the big thing I always thought is I wanted to try to take the hard road in training, so that when it comes to that person who's having their one open heart surgery, that you're the best option for them. But there's a sense of responsibility that you feel. I've occasionally had to operate on friends or family and friends, and that feels a little different.
Yeah.
And which you never, but you got to. That's what you do. So you do that. But I was in a couple college towns where they had famous football coaches, and I was hoping I would not have to do their operations.
Yeah.
That would not happen because they were getting up there in years. I was in Athens for a while, and I was also in Tallahassee where they all love their football coach, and so there are times when that would have made me a little uncomfortable. I think
You don't want to be responsible
Fortunately,
for
I
that.
didn't do that. Yeah, or find a friend, but I don't know. But it's a really gratifying feeling. Where there's a process. Working with a team is great. It feels good to get things done.
Tell us about the team that's in the OR whenever you're doing a surgery, because it's more than just the surgeons.
Absolutely.
While you have tell us,
Absolutely.
because nobody gets to see that. So
Yes, it's really there's a whole lot to it, and there's any little moving part that's got to be right. Much like my dad's space shuttle, doing that. The solid rocket boosters and the external tank and the orbiter and all the things you do to go through that process. And the O-rings were bad on the Challenger one time. The one that had its thing. So attention to detail is so important, and having people engaged. I'm very, and I know other people are as well, but focusing on what you're doing is really, some people play music and all, and you can do that, but I really think it's not at the expense of people focusing on what they're doing and paying attention to every detail. And there's a little saying in heart surgery that there's a snake under every rock, which is wise. So you want to think that way, and that's...
Well, that makes me think about our organization is on its journey for the high reliability organization.
Yes.
And this upcoming year we'll be getting ISO rated, which is like the highest safety within an organization, but it is on that preoccupation. Preoccupation with failure. Like, how can something go wrong, and how can we prevent anything from going wrong, and really making sure that everything is just as safe as it can be.
Right, and I think it's very also important, you study performance, that people are relaxed. The people that you're working with, you don't have them worried about you biting them or getting after them and getting in. That they feel like the people perform their best when they're generally relaxed.
Yeah, they feel
and they also
safe.
have there's a process called team steps. That was a process that was based on an accident in the airline industry, and they looked at how mistakes happen, and you want people to feel free to say, "Hey, that doesn't seem the same way." I may just be the person cleaning up the room, but this part is out of place, and that everybody gets listened to, and everybody has that freedom to
voice if something is a concern,
to
or
really,
just to raise a flag.
So they're not without repercussions.
Yeah.
So I think people perform better when they're not they're not trying to they're not worried about whether they should say that or not. And that's an important part of doing things right. So everybody in our team they're relaxed, they're not uptight, but they're focused. I think is the best way to perform.
Yeah, I think that goes for every department, not just surgery. We all have to have that kind of environment that we,
An environment where you feel freedom to voice concerns, and you feel psychologically safe and supported.
Yes.
And I think that helps in any atmosphere, but particularly in high-risk situations.
Yes, I think that's very true. So so the environment, the people that we have there are outstanding. They come from all walks of life and towns around South Georgia.
Tell me the different professionals you have in the room.
We have an anesthesia team. We have one or two. Usually a nurse practitioner or a CRNA will be in there, and a staff person. We'll have someone running the transesophageal echo that looks at the heart and how that looks pre and post procedure. So you have an anesthesia team of 2 or 3 people. We have a heart-lung machine person, and there's usually one of those that'll be running that machine, which really makes it possible to do what we do. and I have a scrub nurse to my right and an assistant across, and then there's a circulator going around the room answering my phone and answering phone calls and then helping out and sort of moving things. There's about 10 people in general. But it's a fascinating thing. You're used to it, but it's when someone walks in and looks and they're like, wow, there's a lot of stuff going on.
Yeah.
But it's all in concert and working well. People communicate well. That's why it's important, I think, to everybody that they're focused on the patient and remembering that this is their only operation. This may be my 5,000th, but that's their heart surgery. And that I'll occasionally, sometimes you'll have somebody come in and they're maybe a medical student or somebody's visiting, and then they'll start talking. And then I'll stop and I'll say, this is this guy's, pardon us, we're doing this guy's heart surgery, and it's their only operation, and we all want to focus. But I don't have to do that very often. That's kind of but it is important to really remember that this is, we want to do our best. Sounds very serious.
What type of surgeries do you do? So you say heart surgery, but what are the most common procedures that you perform when you're having to do heart surgery?
Most of what we do is Joe and I do, and we all do things a little differently in terms of our specialties that we focus on. But we both do coronary bypass operations,
which is
it is for blockages in the coronary arteries. So from too much Velveeta and Crisco, or maybe you may not.
Help me understand.
Do you remember what Crisco? Y'all old enough to know Crisco is? Do they still have that?
I'm pretty sure they still do.
They do
for you,
still
but
sell it.
some of that and Velveeta, But and also family history can contribute to coronary disease. But so treating coronary artery blockages, but medical therapy, most of the time you can do that for coronary artery disease. Stenting, which we have a great team of interventional cardiologists that do that. And if they can't get that done, then we're sort of the last resort. So a lot of coronary bypass operations. Joe does a great job with the atrial fibrillation of the Mays procedure, and is very aggressive and does a really good job with that. And I think we manage atrial fibrillation here just as well as any place in the Southeast.
And tell us what atrial fibrillation is.
It's just an irregular heartbeat.
Okay.
It is where you have an atrium and a ventricle. Again, going with the camera here, but dink, 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 dink. AFib is where this is dinking too much, and so the flow through the heart's not good, and it's associated with strokes. So it's something that we can manage now with a procedure called the Mays procedure intraoperatively. And Joe does great work with that. I do that as well. But he's done some real pioneering work with that. We also collaborate with Dr. Hannah, our electrophysiologist, and do some minimally invasive AFib things. But AFib is sort of what happens as you get older.
Yeah.
It's interesting. I was at a meeting with Dr. Hannah down in Miami. We were really struggling at that meeting to go to Miami. but it was talking about AFib, so the irregular heartbeat, that it's not really, you don't think of it as a disease, as you would think of gray hair as a disease. It's just what happens when you get old. There's about 10 million people in America that have that, and so it's the way you manage the AFib. So that's what we do. We do coronary surgery. We do Mays procedures. I like mitral valve repairs. I'm very interested in that. That's a really good procedure to do, and you can avoid replacing the mitral valve. And so we did one last week on a lady who was doing great. That's a nice procedure to do. There's some new techniques in mitral valve repair. Aortic valve replacement is something we have done a lot of. The really exciting stuff, the young, great Dr. Seabolt and his team have done with the structural heart program is really a big driver in the whole hospital. It really is a new treatment that's better than what I do. If I have a small lady that has a very small aorta, then I know that a TAVR procedure is much better. And I would want that if I was 75 years old and I had a aortic problem where I would have to go have surgery by me and I would have to open up your chest. But the aortic valve things that we're doing are very exciting. We have Mondays where we all work together.
Yeah, so that's done through the Structural Heart Center that Dr. Seabold and you are a part of. And basically you can evaluate your candidates to see if they are, or evaluate your patients to see if they're a candidate for that versus the open heart surgery. And that is where he takes that catheter up and replaces the valve minimally.
And we're finding most of that's done through the groin, and they're just under sedation, which is amazing. They can get home in a day or two. And we've done some alternative access cases now going through the carotid arteries. We're doing one next Monday.
When you
for
first
that,
started,
which is really exciting. It's a team effort. That's
Yeah.
Colby Ruiz.
Yeah.
And
vascular
then
surgeon.
we'll do that together on Monday.
But when you first started, did you imagine that people would be able to have that procedure done in that manner?
I'm glad it happened.
Yeah, no, but did you envision it?
I
is
didn't
it
think about that. No, I didn't. And I think it's a huge advance. No, I didn't. And
it's amazing to be able to
I'm
do
60,
something like that.
and I got out when I was 36. So that was 24 years ago.
Yeah.
And when I got out of Emory, and no, it wasn't even close. That's only been going on about 10 years.
Yeah.
So it's a
cool.
really dramatic, good thing.
I was going to ask.
And we're doing it right here. That's the best. Really, we have a young, great person doing it, leading that team, and we're all really excited about it.
Well, you kind of hit on it, but I was going to ask what you think makes our heart program, all the different programs, stand out in this region.
The thing I really, really like, and I've seen different heart and vascular programs, is that the vascular surgeons, the cardiologists, and the cardiac surgeons are all on the same page. We're all working for the same team, and in that so it's just one team. That Monday will be an example of that we're working together. Dr. Ruiz and myself and Dr. Seabolt will be doing an alternative access case, and I think having that just synergistically working together is that is a big deal.
Yeah.
I think we've recruited a lot of good young talent here, and there's a fairly scarce supply of heart surgeons nowadays because nobody wants to do the 10-year residency and get out when you're 36 and so it is, and we have a new, and I'll just so I can remember, we have a new person coming, Dr. Guillermo, and he is coming in mid-August and is a star, not just a good heart, he's a top-notch big recruit. That the day that he accepted SGMC Health, he had an offer from Gainesville, he had an offer from in Phoenix, Arizona, and he's a very sought-after heart surgeon who's coming here to be with his friend Colby Ruiz.
Yeah.
And we've given him the environment to bring him here. So I feel like we've reached
awesome.
it. Colby and I feel like, and Dr. Hardy, I feel like we've reached a critical mass to where we've got good young people with a up-and-coming program, very progressive leadership, and just so people are coming.
And the way Dr. Ruiz explained it to me, because I said, well, how can I explain like what y'all do, what type of procedures you do and what the benefit is? And he said, well, we're in the vascular world. He's like, we're a comprehensive, so we can offer this. We can offer all these options, whereas some people can only offer one option, and so they may lend to try to force that one option on a patient because that's the only option they have. Yeah. And when you have options, or when you have access to all these other options, then you're truly doing what's best for the patient and not just trying to pigeon the patient into what you can do. Right. And I thought that was a good way to put it, and it reminds me of what you're saying with having access to all the specialists, is that you can truly do the workup, the evaluation, and see what makes the best sense, and you have all the people already here that can do these things.
And sometimes the best answer is not to do anything. There's something called the mom test, which has served me well over many years. Would I want my mother to have this? I wouldn't operate on my mom, but it would be, is this something sound, and are we just doing this because we can do it?
Yeah.
And a lot of times, the real in this place, you need to know what's appropriate for that we need to do here. Most things we don't send out much as in the heart program, but does anything need to be done at all? There's a lot to be said for medical therapy. There's a lot to be said for and understanding also when you're getting consent on these procedures that they understand all the risks, benefits, alternatives, and it's really not just having them sign a consent, but understand that these are the options. So getting really, but giving them the fancy procedure if it's appropriate. A lot of times trying medical therapy, it works really well in coronary disease. So you can eat some more Crisco and some Velveeta, but you and go on.
No.
Are there any, you've been doing this for a while, so there have to be some patient stories or patient families that have kind of stuck out to you. Is there anything that
There's a
comes
lot.
to mind?
I did. And full disclosure, y'all did give me a couple, the list of the questions. So maybe it's not fair that I get the questions asked. So I thought about a few. I was thinking of some. There's just that really come to mind. There's maybe a couple. There was a young girl who had, it's not really a cardiac surgery, it's more of a collaboration with vascular surgery. She had something called superior vena cava syndrome. She was in Tallahassee when I spent a lot of my career there. She had a young child, a single mother, but had sickle cell disease and had her superior vena cava didn't work. So she had this horrible swelling in her upper extremities and her head, horrible headaches, and she's trying to raise a child by herself. And Dr. Kalin and I did a series of operations over several years to decompress that. Then it would shut down. We'd do another try. We'd go in the chest. We'd try this way. But we decompressed her enough and got her through and got that child raised and through college.
Wow.
And that was very gratifying. So that just came to us. It's not really a heart surgery case. It's more of a collaboration with vascular people. I thought about that as one.
And that's probably rare to do so many, procedures on one patient. In
It is. But I think the importance, and I tell my kids this, is you don't have to be the smartest person. But you need to be the most persistent. And I think persistence, and just do the right thing, and work hard, and really being persistent. That's a very powerful thing to be persistent. So that case came up. I had my perfusionist that runs a heart-lung machine in Tallahassee. Was in his yard, and the tree people were cutting down a tree, and a stick came down and went through his neck.
Oh my gosh!
And through his trachea, and then to his left chest. So he was impaled like something from Braveheart.
Like, yeah.
And so then he pulled it out, and then he came
No,
out.
come on, he should have.
No, it's a true story. And so he came into the emergency room, and he was my friend. He's a heart-lung machine guy. He's a good guy, and he's blowing air out of the side of his neck, and his trachea had been severed. And we fixed that, and that was a thing. Talking about operating on your friends.
Yeah.
But my buddy David Saint was who had been here prior was not in town, so it was like me and another guy, and I went to fixed it, put a patch on it, put the breathing tube past the repair, and it was the middle of the night, so I went back. I was going to go have my stress meal at McDonald's. And I'm halfway there, and they said, we can't ventilate him. And the anesthesia friend of mine advanced the tube a little bit past the repair, it had moved back, and we could ventilate him again. And I left him paralyzed on the ventilator, chemically paralyzed on purpose, for about a week. And then we woke him up and slowly got the tube out.
Wow.
And he lives down at the beach now, and he's doing awesome. So that was a big deal. I just remember that. It's just an odd case, but that one sticks out.
With a lot of your surgeries being, I guess it varies as far as being emergent or, being able to be evaluated over time and scheduled. But how do you handle, how do you prepare for that emergency situation? And, I know you do, and I'm sure it takes just experience over that, but how do the team, how do they?
You need to, everybody needs to be calm. You need to be not just focusing on what you're doing and being calm. It helps others. You ain't got a job to do, and you do it. And you treat everybody the same, and you do it right, and you have a process, and you just continue that process. And I think that's really important. That again, that for performance, that people feel relaxed, and they do their job, and they're not worried about one thing about the freaking out heart surgeon over here, that he's calm or she is calm, and you can perform better. So I think just knowing what you're doing is important. And that's again the training and going through it and paying the upfront price, which is what you do.
And speaking of training, what are your thoughts on, we have a lot of exciting things happening in the medical space here at SGMC Health with our partnership with Mercer, all the residency programs.
It makes us better. And the model with private doctors is okay, but now you have a lot more eyes and ears on the patient, and it's just fantastic. It really raises the bar. I remember when I was at Emory, Dr. Guyton was my chairman there, saying that kind of under his breath. We had something going. It was actually a thing that was kind of related to something a resident had done, and he was just sort of talking to himself in the middle of the night. And he's going, well, on the balance, it's much better to have the residents around because they keep eyes on me. He was just justifying his brain. But he was always right.
Yeah.
Dr. Guyton was a brilliant man. He was the chief at Emory for many years. But he, and I think that's true. There's such to have more eyes and ears on the patient is a big deal, and so it makes us all better. Mm-hmm. Having
kind of like
affiliation.
Competition naturally makes you better too, because if you have competition in any kind of business, it makes you evaluate what you're doing and are you performing the way you should. And while most people don't like it, it does naturally like elevate your performance. And I think that,
are you acting in a way? Are you that you would want this person that's watching you, how you respond? Are you
culture?
You'd be a good example.
And
for
speaking of what are your thoughts on the physician culture here at SGMC Health? Because I feel like it's definitely improved leaps and bounds over the last years, specifically having such an influx of new physicians to the medical staff, not necessarily new to their careers, but new to SGMC Health and their openness and excitement and willing to bring in new things.
Yes. I think
and engagement, I guess.
I do. I think we have a lot of good young people. I don't count myself as one of the youngsters, but I feel young. But they, I think we have a lot of good young talent, and I think that's all. They're optimistic. They're energetic. I think that there's good accountability, which is very important in any organization. So we've got that. I think there's a great spirit. We went yesterday. Colby and Dr. Ruiz and Dr. Hardy and myself went over to take a guy to dinner. He's interviewing from Pittsburgh, University of Pittsburgh. He's a critical care specialist and infectious disease, which is an interesting combination. But he has a fiance, and they're looking at us, and we're able to say, hey, we got some momentum going here, and we like each other. We're sitting here, we're not,
right.
And we do stuff together, and the vascular surgeons, the heart surgeons, we work together, and they see that, and I think we've really reached a great momentum point where you can bring other recruits in,
and
so,
it helps with your quality of recruits you get as well.
Absolutely, it does, absolutely. So I think things are good.
Yeah.
Well, switching gears just a little bit, is there anything that you think that people can do to be proactive so they don't end up maybe necessarily on your operating table?
Don't buy the Crisco or the Velveeta.
When you get stressed out, don't go to McDonald's. That's for sure. For dang sure.
Do as I say, not as I do.
That's right. No, yeah, that's right. I think the really important thing is to, a big thing I see a lot of is insulin resistance, because there's so much food you get now, and there's a lot of things. The way that they get you hooked, and it's very. I think just knowing what your hemoglobin A1C is, and it's not diabetic, not diabetic. There's a continuum. So you're on the scale there, and I go see. Hayes, Dr. Hayes. I go to the doctor, and he runs the residency program. He's fantastic, and he's my doctor. So he checks my hemoglobin A1C, and then getting that, and that's such an important thing that I think there's a big problem with obesity in our society, and it's hard. It's a hard. I think one day they're gonna really get on that the way they've did with alcoholism or other things where you're addiction to food. I think they ought to treat it the same way, because it has such health
repercussions. We've actually had Dr. Laura Guadiana, who's specialized in obesity medicine, and that was the same thing too. I mean, it is a disease, it's an addiction in some sort. And
so I think I think getting after that and making sure you're with your doctor and that you know what your hemoglobin A1C is and you're staying active, and those are important things. I think there's a lot of that out there.
Definitely. Well, my last question is about food, so maybe that wasn't the best segue for me to do. But so at the end of every episode, we ask our physicians, our guests, what their favorite thing to eat is here in our food services.
But in the question, you said specifically the allspice cafe.
Cafeteria or allspice.
Oh,
so
either
one.
Because that was hard. That's hard because there's a thing called a bang bang. I go to the
Never.
I go
heard
to the
of
doctor's lounge. and then you
This is in the doctor's lounge.
and then so you go there and you get your gravy or whatever, and then I would have to come over if I went over the allspice. That would constitute a bang bang. I rarely can make it over there. But I always have
That's
to
the
say,
bang bang. Is
yeah,
you
yes,
you
it's
hit
a
up
bang
both
bang.
locations.
It's when you go out of one restaurant and then to another one. That's called a bang bang. That's it's funny.
You learn
And
something new every day, folks.
my kids, and that was sort of like an eating challenge with my kids. See, here I go. We're just talking about hemoglobin A1Cs, but
know.
then do as I say, not
And
as
you
I,
still
not
have
as I
not
do.
told us what the favorite food item is.
I don't know. I usually get an orange juice or something over there because I haven't. They have a pretty good made to order thing in the corner. Like get a
Oh yeah, your sandwiches and
get a
stuff.
little chicken sandwich over there.
Yeah, or
pretty
wraps
good
and stuff.
Pretty
yeah.
solid. My favorite thing though, we don't know if you were here, is the What's Cooking hotline.
Oh,
Do you know about that?
Yeah, it still exists.
It's hilarious. I kept that number.
It still
And I sent it
exists.
to some of my friends in Atlanta. It says they would call it the What's Cooking hotline.
Yes,
and then
yes.
maybe the vegetable bar was the hot dog bar or something. They would
Oh,
say.
my
And that lady
goodness.
she was really cute.
Yeah, so
I don't
this
know
was a number
if
you
she's
could
still
call and
around.
you could hear it was the What's Cooking hotline.
I still have it on my phone.
You know, this was kind of before
Yeah.
computers became such
Right.
a big deal where you could look at the menu online. We had it
Yeah.
on hotline. We do still have the hotline, so
yeah.
I'm gonna
But
have to
it's funny
call
when
it
they
after
say
this.
that the vegetable bar is the hot dog bar. It's kind of today we're just sort of serving the hot dogs.
Yeah, we don't do that anymore. That's definitely an
I'm
old
sorry,
school
yeah,
thing.
but it is excellent food. The food is excellent, and it is very, very good. But that's the deal. I think they spoil us though with the food and the
Yeah.
doctor's
I
office.
think they
That's
do, too.
dangerous. You got to kind of. They need to cut off my card there. So.
Okay, that's okay. Well, you can always just give us your card and we will take your meal
We'll
for
get
that day. if you
Deactivate
want.
that for a little while. But anyway, no, I'm just in general, I'm very, very proud to be here, and this is such a great organization.
Well, I know you were talking about those top recruits, and we
Yeah.
felt the same way when
Yeah.
we were able to
No.
land you
No,
to come
yeah,
back
well,
here.
Anyway,
So
I'm
we're
glad to be
glad that
Glad to
you're
be
here. Yeah.
Very glad to be here, and y'all do, the three of you. I think you're pretty outstanding.
Well, thank
Thank
you.
you.
I think you really are. You really represent things well.
Y'all make our job easy.
Yeah.
So, all right. Well, thank you for coming in,
Thank you.
and we'll get you back on again later and hear about all the next steps and new advancements. I'm sure you'll have by the time we circle back around.
Okay.
All right, thank
enough?
you.
That's
Yes,
good. You
thank you
did good.
everyone
All right,
for
all right.
listening today. And if you have any questions, you can submit those at sgmc.org/podcast. And don't forget to like and subscribe.